Okay, so to begin today, I just want to introduce a couple of people that are here. My name is Kevin Page. I am the sales executive for Humana for the FMO partnerships. So I work directly with the FMOs. I cover Texas, Oklahoma, and New Mexico. We have local market leadership here. Paul Carter is the director for East Texas. Some of you guys already know Paul. We also have Benny Marquez and Michael Corello, and both of those guys are in the back. Most of you already know them. They are the ones that conduct the face-to-face trainings, and they answer a lot of questions for you when you call into the local market point office. So what we want to talk about is Humana today. We have an elephant that's in the room we'll talk about in just a second, but I want to review a couple of things for you guys just so you understand where Humana comes from and what we're able to do for you guys. So we're a Fortune 100 company with 50 years experience. We're a healthcare company that works on vitality for the members. Vitality. Vitality is something that we talk about with Silver Sneakers through our Medicare programs, and vitality is something that if you personally have the program, the Humana product, you also have an opportunity to work within the vitality program. We have multi-products. We offer HMO, PPO, private fee-for-service, prescription drug plans, junior estate builder. We offer all lines of products. 3 million prescription drug plans, members nationwide. That's a goal that we hit recently that we're extremely proud of. What Humana can do for you. This is extremely important for you guys. We have self-reporting tools. We have the agent Workbench, which each of you should be aware of. If you're not, reach out to agent support or your local leadership. Your agent Workbench is your link to everything Humana. Electronic enrollment options for 2015 is mentioned there, tablet and laptop. We do have Android system, we do have the iOS system, so you should have the availability for electronic applications. We're strong in the Medicare Advantage and PDP. We do offer ACA plans, and we'll talk about those a little bit more this afternoon. These are the value-added services that we offer, and you can see the third one down, RightSource. Everyone in here should be aware of RightSource. RightSource is Humana's pharmacy. And Humana's pharmacy is now called the Humana Pharmacy. Okay? Lots of times I get a little giggle out of that. But we were called RightSource for a long time, and it's going to be easier for your clients to understand that their prescription drugs are going to come from the Humana Pharmacy. Same program, same mail order program. You still have those opportunities with your clients. There are discounts. The one closest to the bottom, discounts for hearing, vision, and dental services and over-the-counter medications. One thing I want to caution you about is that's the discounts that we're not supposed to talk about. Those are the value-added services that you can't discuss during your enrollment time with your member. Okay? So here are some additional opportunities that Humana has to build long-term relationships with your clients. The Wellness and Prevention Program, you can see these are the companies that are represented through each one of our divisions. The primary care, RX, obviously, chronic care, and of course, informatics, which we do. We also have the mental illness division, and I don't know if it's mentioned. Yes, LifeSync. And I don't know if any of you guys have seen, but coming through Las Colinas, there is a LifeSync building that is there, and that is the Humana Mental Illness Division. All right, so let's talk about plans and products. That's what you're here for, and we'll get into some specifics. I mentioned these guys already. Remember, Mike and Benny are in the back. So when we get closer to the break times and lunchtime and stuff, be sure and visit us back there. We can answer some specific questions for you if you need. All right. Let's talk about the network. For the HMO for Dallas-Fort Worth, the Baylor Network, UTSW Network, we have the North Texas Specialty, Integranet, and Genesis. The HMO on East Texas is extremely important also because we have East Texas Medical. We also have Coleman Carney, Titus Regional, and you can see the other ones there. And any of you working in Houston, we also have a very strong network in Houston with Memorial Hermann and Integranet. Go ahead. All right, so within our senior product division, in our products, we offer Medicare Advantage plan, prescription drug plans. We also have supplements and the value-added services, obviously. But dental, vision, and then in supplemental, we also offer a junior estate builder as well as some critical illness plans. We have a very large geographical footprint. We do have a regional PPO that's in every county in the state, and we'll talk about it in just a second. We have MA products only that are specific to counties, and we also have Medicare supplement plans within the state of Texas. Let's talk a little bit about integrated care model. Humana is moving, like other companies, is moving toward risk models with their hospitals, with their physicians. They're doing a much more intricate job with managing the health care of your clients and of the members. So one of the things that you will see as a trend in the market is going to be toward moving the PPO or the private fee-for-service person towards the HMO model. Now, a lot of people, they don't have comfort level with the HMO model, okay? So if I had a show of hands, since we're just visiting here, if I had a show of hands, who does not care for the HMO model? So I would say 50%. So what would be the reasoning behind not caring for the HMO model? Okay? So I hear access to good docs was the first one that I heard. Does everybody agree with that? So what would you say if I told you that the HMO models are actually becoming larger in their networks than the PPO? So within an HMO model, and I have to speak in generalities here, in an HMO model, if you go to your primary care physician, a lot of times a referral is only needed for a major specialist. It's not used for, well, I need to go have routine something done somewhere at a specialist. So if it is in fact something like that, yes. But what we're going to have to do is understand that we are trying to drive that member into a healthier relationship with themselves. And by doing that, we have to keep them within the network of the physicians within that HMO who understand the reasoning behind the preventative services, making sure they get to their PCP or their specialist to have their annual exams. I will tell you, I have parents that are on Medicare Advantage. One of them is on a Humana plan, one of them is not. And one of the hardest things for me, and I don't know if this is what it is for you guys, is to get them just to go to the doctor. Some of your clients go all the time. You don't have an issue with those guys. But some of them won't go at all. And if they do go, they fight the physician. They fight the PCP. They already know what's wrong with them. They don't need to be told. They need to go here. They don't need to. So what we try to do within the HMO model is give that option, make it a little easier for your client, the member of the plan, to get inside the system. Once they get in the system and we can show them how easy it is for them to access that system, then we'll have them there for a while, okay? Very few people go from PPO to HMO and then back to the PPO. Once they understand the system of the HMO, they're typically there. Now, that's not to say that one is better than the other, but I will tell you that the trend in the industry, in the insurance and in the plans, the trend is to go towards HMO. All right? To go to HMO, I think what you'll start seeing is a lot of your hands going up where you're not. Keep an open mind about the HMO model, because I think what you'll see over the next few years is more and more people going towards the HMO model. And in doing that, they'll be able to access their health care, have access to their health care, and access to their physicians a lot easier. Okay? So that's my 2 cents worth on that. Let's get back to something important here. Okay, here's the elephant in the room. Let's talk about this for just a second. So everybody's heard about Humana and Aetna, right? Okay, so I've already had a couple of comments this morning about, well, you guys are already working together. I would love to say we're working together. Hey, Jason. Jason's with Aetna. We're not working together other than just what we normally do, okay? So here's some bullet points that I just want to reiterate. The third one down is going to be important for what we talk about. So until the transaction closes, which is expected in the second half of 2016. Second half of 2016, right? Humana remains separate, independent company from Aetna. Okay, we'll operate business as usual. Our health plans and operations, business as usual. The third one, we expect to offer a Humana-sponsored open enrollment period May for 2016-2017 plan benefits. Do not let that confuse you. What that is saying is 2016-2017 benefit plans, we have to go ahead and submit in February, March, April for CMS to approve it for next year. So since it closes in the second quarter of next year, the merger, then what we've got to do is we've got to go ahead and present that. So in essence, what I'm saying is Humana will have a plan this year with no changes going into this AEP, and in all, everything I can understand and what this says is we will present another one to CMS for the next AEP, okay? So we can pretty confidently say there will not be an Aetna, Humana name change on any marketing items or product going in for at least this AEP and next AEP. Hope that makes sense. So your day-to-day contacts remain the same. Local market guys for Aetna, local market guys for Humana, we're the same people, okay? And our members should experience no changes. That's extremely important in their current coverage. We're not losing plans. We will continue to manage the networks just the same as we always do. Go ahead. Here are some milestones. We were noted as ranked as 25th. As we talked about earlier, that's what kind of threw me off because I was waiting for that slide. We actually moved up. We are at 25th. We've actually moved up on the Fortune 500 to 73rd, or 58th from 73rd. And more importantly, we surpassed our hiring goal for our Veterans Initiative. So we set out to hire a certain percentage within our base, and we actually hired 2,300 veterans and military spouses, and we surpassed our goal by about 20%. So we've done a very good job in the company of Humana by supporting our veterans. All right. Okay, we already did this one. We did that one. Okay, so let's talk about what's changed, and we'll get into some serious stuff right after these next slides. Plan numbers on all HMO plans have changed. Don't ask me why, but they have. Okay, so everybody realizes that when you work for Humana and you enroll, you have your cheat sheet, right? And you have to put your H number, and you have to put your item number, and you have to put all that stuff on your enrollment. Your new sheet through your agent portal and through your, when you order your kits, all of that will be there. Your new enrollment sheet will be there that has your numbers on it. And I see some people shaking their heads. Believe me, I'd love to have that conversation with leadership, but it is what it is at the moment. Reduction in Kaufman County from HMO. Applications sent within 24 hours. It didn't change, but I want to make sure that we understand. Humana has a 24-hour period of time where you have to turn in your enrollment kit, your enrollment form. That makes sense? Okay? That is a requirement that we have internally with Humana so we can meet the CMS requirements. All HMO and PPO plans require a PCP. Any problems there? Okay, go ahead. All right, these are generic changes you'll see on a lot of the plans. ER copayment is now $75 from $65. Special needs facility, there is now a charge of $160 up from $150. Ambulance, and then you can see the other ones. All right. Okay, top value prop. Most of the time, HMO is normally the strongest value prop, right? So, and we've talked about the networks just a few minutes ago. Here it is again. USMD and Genesis have been added. Good Shepherd and Watley that we had from just a few minutes ago, I went ahead and mentioned just now, but networks have remained basically the same. Go ahead. All right, so let's talk about some plans. Here's where you want to take a few notes. Okay, the formerly 018 plan, which is the HMO. It's a 0 monthly premium, 0 copayment for PCP. Hospital copays $225. This is key. No deductible for RX on tiers 4 and 5. Okay? I said that just wrong. No deductible tiers 1, 2, and 3, but there's a $200 deductible for tiers 4 and 5. How about that? That help? All right. Outpatient surgery, there is a $25 over-the-counter benefit added this year, and it also has silver sneakers. So, good solid little plan. You can see the counties at the bottom. Go ahead. This is the East Texas HMO. It has a $29 monthly premium, $5 PCP, 45 specialists. Good solid little plan for East Texas. Hospital co-payment, $295, 1 through 5. You can see the counties at the bottom. You guys are, those of you who work out in East Texas, you're very familiar with this plan. It did very well last year for you guys. Here's the RPPO, $20 monthly premium. This is a good solid item. Remember, this one is statewide. Hospital, $335, 1 through 5, $25 PCP. This one also has an RX deductible for tiers 4 and 5. 1, 2, and 3, no deductible. All right, here's the local PPO. Local PPO is $71. Maximum is $67. Hospital is $325, 1 through 5. 45 specialists. We have 25 over the counter. The RX deductible again is only on tiers 4 and 5, and it has silver sneakers again this year. Here is another RPPO that goes along with the $20 one that we had a few minutes ago. This one is a $74 monthly premium. It has a hospital of $325, 1 through 5. It has a 25 over the counter. RX deductible 4 and 5, no silver sneakers. This one is an MA only. MA only RPPO. As you can see, 0 premium, $295, 1 through 5. You have over the counter of 25. Remember, this one is an MA only. Here is another MA only, private fee for service. This one is $20. And you can see the benefits there that are associated with that one. Okay. This one is the private fee for service with the MAPD on it. This one has gone up a little bit to 95 from 89, but it's still a very solid product. It is sold in quite a few counties that are not available with other plans. So the top value prop is the HMO. You can go ahead and, we've talked about this already. Go ahead and move that slide. So we can talk about what we can do, what Humana can do for the agents. We have, go back one for me. We have some electronic self-reporting tools. We have electronic options for tablet options. And I mentioned a while ago the iOS and the Android. There's a MAPA app. There is a Fast app. You can also go online through your agent portal. Just want to give you guys a heads up. You can use your agent portal just like you can use Medicare.gov. Your agent portal will give you specific Humana information. You can type in medicines. You can go through and type in all the information and find the plan. You can also do online enrollments for the ACA products through your online portal. Don't forget that in your agent portal, you can also order your marketing materials. You guys walked by our table today. I had some stuff up there that I wasn't giving away. That is because my wife would be very upset if I gave her starter kit away. So those are some items that you can go on in the Medicare portal. Click on Medicare and marketing items, and you can actually order brochures. You can order starter kits. You can order buttons and all kinds of stuff. Okay? So just to give you a heads up, there's more in your agent portal than just checking your commissions, which I do realize that's the most important part. I just want to give you a heads up on that. Go ahead. And we also want to thank you for being a Humana agent. One of the things that we strive to do each year is get more and more agents. But, you know, there comes a time where we have to concentrate on you guys that are already our agents. And we want to make a special point and appreciation for what you guys do for us. We have great plans. We hope to offer great benefits and great services to your members. and to your clients. And as we do that, we want to concentrate on what we give you guys, especially in a comprehensive product, service, and support. I've recently worked with the agent support unit. I know somebody in here's got a nasty story about the agent support unit from Humana. I've worked with those guys. I went up and sat and I put the earphones on, and who knows, I might have listened to one of you guys call in. And I will tell you, we are doing everything we can with the massive amount of requirements and regulations that CMS puts on us, as well as the data that we have to bring in to give you guys the information that you need. Number one rule, use your upline, okay? Agent support is there for you, but if you've got something that you think that your upline can use, reach out to your local upline rep, your person that you work with locally, ask them that question, because that question might have been asked 30 times already, and it might be something that needs to be addressed or can be addressed easily, okay? And then questions, comments, come see us at the Humana table in the back.